topic is molar, gestation, or trophoblastic disease. In which what we learn is like we have a partial mole as well as complete mole. What a partial mole means? Partial mole means generally our egg oocyte and sperm meet and they will make a normal mole. But when it meet with two sperms meet one oocyte, it will form three pronucleus. But in general, normally we only make two pronucleuses. That will form a zygote, embryo. But in partial mole, two sperms are meeting one oocyte and making three pronucleuses. So we will get our triploidy 69 and triple X. And generally, this partial mole cannot withstand in the endometrium and it will abort itself within 12 to 16 weeks of gestation. This is partial mole. And generally, when it comes to complete mole, we have empty oocyte and only one sperm is meeting. Due to empty oocyte, we cannot make all like a embryo. But we have our like a genetics like 46 XX chromosomes or 46 XY. It will never be 46 YY. This is called a vascular mole. And in complete mole we never see embryo or zygote formation. We have differences between partial mole and complete mole. Like in partial mole we at least see fetal tissue and we have a trophoblastic hyperplasia, and on ultrasound we can see this focal mode, and there will be also swelling of a villi to this placental attachment, as well as there will be trophoblastic stromal inclusions also present. But in complete mole we only see this diffuse mode on ultrasound, as well as in complete mole we see these high levels of ECG present in complete mole due to thyrotoxicosis. And in such patients of complete mole we also see patient having hypertension, as well as they will increase their heart rate, cardiac output increases, and they also get a fever in complete mole. And we have to keep beta blockers readily because they are getting hypertension in complete mole. So beta blockers should be ready. We have to give. And generally, how this molar gestation presents in female. The female who takes more rice and females who have less vitamin A in their body, and as well as if a female is older woman, like she is like crossing our like 35 place, it is nearly she's reaching to menopause. So in such females there is high chances of getting molar gestation, like we get a partial molar like. And when we want to diagnose, we just use HCG levels. In normal pregnancy, we don't prefer HCG levels follow-up because it will increase the incidence of carcinoma. But in cases of a partial mole, we have to follow up these HCG levels as well. It is one of the diagnostic criteria, and we also use ultrasound. And the specific diagnostic method is flow cytometry, and also we use immunochemistry, in which we will see P57 gene absence. P57 gene absence is seen in complete mole. It is diagnostic of complete mole. And we have appearance of grape-like vesicles present in this partial mole. And for the management of partial mole as well as complete mole, we prefer management of a suction evacuation as well as curettage. In such patients, we also see bleeding coming from paravaginal. Paravaginal bleeding is common. It is like a scanty blood with like a brownish color of blood coming from vagina. So we have to do curettage as well as suction evacuation of formed fetus. If we don't do, even it will get out by 12 to 16 weeks of gestation. Yes, ma'am. So, and in such patients of partial mole or complete mole, there will be increasing of hypertrophy of this uterus also happens. And in complete mole, on ultrasound we will see some complete empty space, and if we touch like palpate, we will feel like a duffy feeling. Duffy feeling means like we pressing that empty uterus. Duffy feeling. So this is about the partial mole as well as a complete mole, as well as